There is a 25-second span each morning that many Americans over the age of 60 may be unknowingly turning against their own cardiovascular system. It is not related to diet, not tied to exercise habits, and not dependent on prescribed medications. It occurs in the very first half-minute after the alarm activates. A chain of behavior so automatic, so embedded in daily routine, that most people never stop to examine it. The reason many physicians rarely highlight this is not lack of awareness. Medical training tends to prioritize visible risk markers such as cholesterol levels, glucose readings, body weight, and blood pressure measured in resting clinical settings. What is often overlooked is what happens inside the cardiovascular system during the first 25 seconds of waking, when the body shifts from sleep into alertness. Cardiology researchers focusing on sudden cardiac incidents, especially those studying timing rather than only causes, have repeatedly identified a consistent pattern. Fatal cardiac events are 3 times more likely to occur within the first 3 hours after waking compared to other similar periods of the day. This is not a slight increase, not a minor fluctuation, but a 3-fold elevation. A Harvard-linked analysis reported that the relative risk of heart attack during this early waking phase is increased by a factor of 3, and this finding has been confirmed across multiple decades of cardiovascular research. The explanation for this vulnerability begins with a rapid internal cascade triggered as soon as consciousness returns. Many individuals unintentionally intensify this process within those first critical seconds. Understanding this requires looking at what the body is doing during the transition from sleep to wakefulness. Sleep is often imagined as a uniform resting state followed by simple awakening. In reality, the physiology is far more complex, and the shift out of sleep represents a major cardiovascular transition. During deep sleep, the nervous system operates in a recovery state. Heart rate slows significantly and remains steady. Blood pressure reaches its lowest daily point, sometimes 10 to 20 points below normal waking measurements. Stress hormones are suppressed. Blood vessels remain relaxed and expanded. The heart, continuously active throughout life, receives one of its most stable periods of reduced strain. As morning approaches, the internal circadian system begins preparation for wakefulness. Cortisol starts to rise before dawn, but the most significant surge occurs rapidly once the eyes open. Scientific research published in peer-reviewed journals and confirmed in circadian studies shows that cortisol levels increase by 38% to 75%, with an average rise of around 50% within 30 to 45 minutes after waking. This process is known as the cortisol awakening response and is one of the strongest hormonal shifts in the human daily cycle. At the same time, the adrenal glands release epinephrine, also known as adrenaline. These 2 hormones flood the bloodstream immediately after waking. They serve an important biological function, preparing the body for activity. Heart rate increases, blood pressure rises, blood vessels narrow slightly to redirect circulation toward the brain and muscles. In younger individuals around the age of 40 with flexible arteries and smooth vessel walls, this transition is generally well tolerated. However, after the age of 60, several structural and physiological changes alter this response. First, arteries become stiffer. Natural aging reduces the elasticity of arterial walls. A rigid artery cannot absorb pressure changes as effectively as a flexible one. A pressure wave that is minor in a younger system can become significantly more impactful in an older cardiovascular system. Second, in many individuals who may appear completely healthy and asymptomatic, arterial plaque can be present. It may not be severe enough to produce symptoms or appear on routine electrocardiograms, yet it can still be vulnerable. A sudden increase in pressure can rupture the surface of these deposits. When a plaque ruptures, it can trigger immediate clot formation. A clot in a coronary artery leads to a heart attack. If a clot travels to the brain, it can result in a stroke. Third, blood composition changes in the morning hours. After 6 to 8 hours without fluid intake, the body wakes in a mildly dehydrated state. Blood becomes more concentrated and viscous. Clotting factors, the proteins responsible for initiating clot formation, are at their highest levels during this time of day. This means that upon waking, the cardiovascular system is already under multiple simultaneous stresses. Arteries are stiffer, blood is thicker, hormonal activity is elevated, clotting potential is increased. At this exact moment, many people perform a simple movement without hesitation. They sit up quickly and swing their legs over the edge of the bed in a single motion. This is the so-called 25-second mistake. Although it appears harmless, this movement has immediate physiological consequences. When lying flat, blood is distributed relatively evenly throughout the body. Gravity has minimal effect on circulation. Once the body becomes upright, gravity causes a rapid shift of blood toward the lower extremities and abdominal region. Venous pooling increases in the legs. Less blood returns to the heart and brain. Blood pressure in the upper body drops within seconds. In younger individuals, the baroreceptor reflex responds almost instantly. Sensors in the arteries detect the pressure change and signal the heart to increase rate while constricting blood vessels, restoring pressure within 2 to 3 seconds. In adults over 60, this reflex response is slower. Signal transmission takes longer. Vascular constriction is delayed. Before compensation occurs, systolic blood pressure can fall by 15, 20, or even 30 points within seconds of standing. Many individuals recognize this as a brief sensation of lightheadedness or mild instability upon rising in the morning. It is often dismissed as a normal part of aging. In medical terms, this is known as orthostatic hypotension. It is defined as a drop of 20 millimeters of mercury or more in systolic blood pressure within 3 minutes of standing. Research published in Science Direct indicates that this condition affects approximately 20 to 30% of adults over the age of 70. This means roughly 1 in 4 or 5 older adults may experience it daily without recognizing its significance. That longer exhalation compared to inhalation is not accidental. It directly signals the parasympathetic system to engage, slowing the stress response before it fully escalates. It is a deliberate way to counter the first surge that arrives with waking consciousness. At the same time, another physiological reality is already in motion. The cardiovascular system is entering a period where multiple stressors overlap. A compensatory heart rate increase is already building on top of the cortisol surge. Arterial stiffness is already present. Blood consistency is already elevated. Each factor reinforces the others within the same short waking interval. Large-scale research tracking acute cardiac incidents shows a clear concentration of events between 6 in the morning and 10 in the morning. This is not a vague association with early hours. It reflects a specific convergence of biological processes activated by waking and intensified by rapid posture change. The danger is not in any single factor alone. It is in the stacking of several independent stress responses occurring at once within seconds of standing. This is why the 25-second transition after waking is so critical. It is not visually dramatic. It does not feel like an emergency. That lack of sensation is part of what makes it risky. There is a patient example often used to illustrate this pattern. A man referred to as Raymond, 71 years old, retired engineer. He did not neglect his health. He used a continuous glucose monitor to observe glucose trends. He recorded blood pressure twice daily. He had been prescribed a statin and a low-dose beta blocker for several years. His most recent echocardiogram was described as reassuring by his cardiologist. A stress test conducted the previous year showed no significant ischemia. From a clinical standpoint, his cardiovascular risk appeared well managed. On an ordinary morning, he turned off his bedside alarm and sat up immediately. Within 3 minutes of waking, he was in the kitchen preparing coffee. His wife later reported hearing movement and finding him leaning on the counter, confused and sweating. He was transported to the hospital within an hour. He did not experience a fatal cardiac arrest. Instead, he suffered an acute coronary syndrome involving a partial arterial blockage caused by plaque rupture followed by clot formation. He survived and recovered. When the timeline was reviewed afterward, the sequence aligned precisely with known physiological triggers: rapid sitting after waking, immediate movement, morning dehydration, increased blood thickness, a pressure surge created by compensatory cardiovascular response, a vulnerable plaque that had remained silent for years until that moment of stress. What stood out in his case was not unusual test results. His medical profile had not suggested imminent danger. What was missing was attention to the waking routine itself. No prior discussion had focused on how he transitioned from sleep to standing. No one had examined the first minute of his day as a cardiovascular stress event. It is important to clarify that his medications and monitoring were appropriate. His clinical management was not incorrect. The missing element was understanding that the sleep to upright transition functions as a distinct physiological load on the cardiovascular system. Before discharge, small adjustments were introduced. These changes required no equipment and no cost. At a 6-month follow-up, his morning blood pressure readings showed greater stability. The dizziness he previously experienced upon waking had resolved. He was asked why this had not been explained earlier. The explanation was that much of this research exists within specialized cardiovascular and sleep medicine literature and is not consistently emphasized in routine clinical visits. This gap between research findings and everyday medical guidance is where many preventable risks remain unnoticed. There is also a third contributing factor that often receives less attention. It involves respiration during sleep. Many individuals breathe through the mouth during the night, especially when sleeping on their back or experiencing mild nasal obstruction or sleep-related breathing disruption. Mouth breathing increases fluid loss. Research indicates that water loss through exhaled air is 42% higher in mouth breathing compared to nasal breathing. Even without mouth breathing, normal respiration and skin evaporation result in fluid loss of approximately half a liter to 1 liter overnight. No intake replaces this loss during sleep. By morning, this produces a measurable reduction in plasma volume. The sensation of thirst does not reliably reflect this early deficit. At a physiological level, blood becomes more concentrated. From a circulatory perspective, the heart functions as a pump moving fluid through fixed pathways. When fluid volume decreases, viscosity increases. The heart must generate higher pressure to maintain flow through the same vascular structure. Research dating back to the 1960s documented that hematocrit and blood viscosity are elevated in early morning hours. This has been confirmed repeatedly in later studies, including reviews published in Circulation Research, a journal associated with the American Heart Association. When this is combined with arterial stiffness, hormonal surges, and sudden posture changes, the cardiovascular system is briefly operating under multiple simultaneous stressors within a very short time frame. Clotting dynamics add another layer. A protein known as PAI1, plasminogen activator inhibitor 1, plays a central role in limiting the breakdown of clots once they form. Research published in the journal Blood, including work involving Harvard Division of Sleep Medicine researchers, found that PAI1 reaches peak levels around 6:30 in the morning, aligning with the highest risk window for cardiac events. Platelet activity follows a similar pattern, increasing clot formation potential during early waking hours. This pattern is not considered a defect in human biology. It is believed to have been adaptive in environments where waking involved immediate physical demands. However, in modern conditions involving pre-existing vascular vulnerability, it can increase risk during the morning transition. One simple intervention consistently associated with improved morning cardiovascular conditions is early hydration. A single glass of room temperature water consumed before standing can begin restoring fluid balance. Not coffee, which can increase fluid loss. Not sugary juice, which introduces metabolic load before food intake. Plain water. Keeping it accessible at the bedside allows intake before the feet touch the floor. Studies on morning hydration in older adults show measurable reductions in blood viscosity and platelet activity following early fluid replacement. While one glass does not fully restore overnight losses, it initiates recovery at a time when the cardiovascular system is most sensitive. To integrate these factors, a structured waking approach can be applied. It requires approximately 90 seconds to 2 minutes and does not involve any equipment or supplements. The first element is stillness breathing. Upon waking, remaining in a flat position without immediate movement allows the nervous system to stabilize before full postural change. During this period, controlled breathing is used to influence autonomic balance. 4 cycles are performed with nasal inhalation lasting 4 counts, a brief hold of 1 count, and exhalation through the mouth lasting 6 counts. The extended exhale supports parasympathetic activation as the initial hormonal surge begins. It directly activates the vagus nerve, which is the main biological pathway the body uses to suppress and regulate stress responses. Through this pathway, the system applies a braking mechanism to rising physiological tension. A study published in Scientific Reports found that slow, controlled breathing with an extended exhale increased vagal tone in both younger and older adults. Notably, the effect was stronger in the older group. The nervous system responds to this measurable shift, and research confirms its impact. 4 breaths, around 15 seconds in total, are enough to activate the parasympathetic branch of the nervous system at the exact moment the cortisol wave reaches its peak. This happens before that hormonal surge can fully elevate heart rate and blood pressure into a high-risk morning spike. Controlled breathing research in adults over the age of 60 shows measurable reductions in systolic blood pressure when slow breathing is performed. immediately upon waking, while still lying flat and before any movement occurs. This represents the first layer of protection in the sequence. The second step is hydration, 20 seconds in duration. Before sitting up while still in a reclined position, the individual reaches for a glass of room temperature water placed on the nightstand the night before. The timing is critical. Once upright, the cardiovascular cascade is already in motion. Drinking water before standing provides a small but meaningful circulatory buffer. It begins to thin blood concentration slightly, initiates plasma volume restoration, and reduces clotting factor density before the heart faces gravitational stress. Preparation begins the night before. A glass of water is filled and placed beside the bed so it is available before any movement begins in the morning. This single action changes the physiological starting point of the next day's cardiovascular response. The third step is a gradual transition lasting 45 to 60 seconds. Movement is slow, segmented, and controlled. First, the body rolls onto its side. This is essential. Sitting up directly from a flat position creates a sharper pressure shift. Rolling to the side reduces the abrupt cardiovascular load. From the side position, the individual pushes into a seated posture using the arms. Feet are lowered to the edge of the bed. Standing is delayed. While seated, ankle rotations begin. 10 circles in each direction. This is not incidental movement. The calf muscles act as a major venous pump. When activated, they help return pooled blood from the lower extremities back toward the heart, supporting circulation before standing. Research indexed on PubMed involving ankle plantar and dorsiflexion exercises shows that approximately 1 minute of ankle movement before standing can reduce the systolic blood pressure drop upon rising from a median of 17.5 millimeters of mercury to around 1 millimeter of mercury in individuals with orthostatic hypotension. 1 minute of movement produces this measurable effect. After ankle movement, the seated position is maintained for approximately 30 seconds. For individuals who commonly experience dizziness or visual fog upon waking, this pause allows baroreceptor reflexes to stabilize before full upright posture is reached. Standing then occurs slowly. Force is directed through the legs rather than pulling upward with the back. Once fully upright, the individual remains still for 10 seconds before taking the first step. The fourth step is a temperature check. This step is optional, but important in its purpose. While seated at the edge of the bed, attention is briefly directed toward bodily sensations. Any chest heaviness not present the previous night, any unusual shortness of breath, any radiating pain or pressure, or any abnormal pounding sensation in the chest is noted. Most mornings present no concerning signals. That absence itself forms the baseline. However, the value of this step lies in establishing a consistent awareness window. When changes occur on a different morning, they are more likely to be recognized early instead of being ignored in the rush toward daily activity. This entire sequence requires between 90 seconds and 2 minutes. It is simple, free, and does not require equipment or medical intervention. It directly addresses the 3 converging physiological factors that define early morning cardiovascular vulnerability: hormonal surges, postural blood pressure drops, and increased blood viscosity. An additional consideration applies to individuals taking beta blocker medication. A significant number of adults over 60 fall into this category. Beta blockers function by reducing the heart's response to adrenaline. This mechanism is effective for managing blood pressure and rhythm conditions. However, it also reduces the heart's ability to rapidly increase output when compensating for a sudden drop in blood pressure upon standing. Research from the Irish Longitudinal Study on Aging, published in peer-reviewed literature, found that beta blocker monotherapy was associated with more than twice the odds of initial orthostatic hypotension and more than 3 times the odds of sustained orthostatic hypotension compared to individuals not taking these medications. This does not indicate that beta blockers should be discontinued. They are prescribed for important clinical reasons and provide life-saving benefits. However, it does indicate that the morning transition becomes more sensitive for individuals using them. For these individuals, the gradual transition phase is not optional. It becomes essential to allow additional time before standing fully upright. If persistent morning dizziness occurs, it should be discussed with a physician, specifically in relation to medication timing or dosage and its impact on morning symptoms. The broader conclusion is clear. The morning period is not randomly risky. It is a biologically structured window in which multiple physiological systems overlap in stress response. Hormonal activation increases arterial pressure. Postural change reduces cerebral blood flow temporarily. Blood viscosity is elevated. Clotting potential is higher than at other times of day. When combined with the common habit of immediately sitting and standing after waking, these factors align in a way that increases cardiovascular strain within a very short time frame. The 4-step waking protocol does not require changes to diet, medication, or long-term lifestyle structure. It requires a glass of water placed beside the bed, a brief period of controlled breathing, a slow staged rise from lying to standing, and a short awareness check. This sequence takes less than 2 minutes. It is the only adjustment needed to significantly reduce stress on the cardiovascular system during the most sensitive part of the day. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.